This bill could potentially represent the largest change in a federal entitlement program, maybe in the history of the country. This would be taking away a program that has existed for 50 years and changing it into a very different structure. Medicaid is the country's largest government health insurance program. It covers about 74 million Americans, 4 out of 10 of every American children. 50% of all children who are born are covered by Medicaid. There are more than 10 million Americans with disabilities. 2/3 of all Americans who live in nursing homes are being paid for by the Medicaid program. There are also many millions of people in America who are just poor, and Medicaid is helping them pay for treatment for opiate addiction or for chronic disease care or just for basic checkups. Most of the Medicaid dollars actually don't go to poor Americans. Even if you're a middle-class person now with a lot of savings, if you end up needing nursing home care that's $100,000 a year, if you're a person who has a child with a disability, now or in the future, care for a child like that can be extremely expensive and difficult to cover with commercial insurance. Medicaid is the program that cares for those people. Medicaid is run a little bit differently in every state, and it often has a different name. So a lot of people who are covered by the Medicaid program may not even realize that Medicaid is where they get their insurance. What Obamacare did is expanded Medicaid to cover more Americans by saying that everyone in every state who earned less than about $16,000 a year could become eligible for Medicaid if their state wanted to expand. About 31 states did, and so it's been a very large expansion of health insurance coverage to low-income Americans. The details of the Republican health care bill are still not final, but it's pretty clear that there are going to be 2 really large changes to Medicaid as part of this bill. One, it cuts way back on the money that's available to states to cover this new expansion population. The other big change is more consequential but has received less attention, is that it will change the way that the federal government pays for all of the people who get Medicaid. It would essentially put the federal part of that spending on a diet. Some independent estimates suggest that the cut could be as much as 1 in 4 federal dollars that states are getting now they would no longer get. You should care about this because Medicaid is a big program that serves a lot of people, and it may serve you one day.